Hi, everybody. Welcome again. We're going to get started here now. I know the attendees will continue to join us, but we're really happy and excited for you to join us for this hour today. My name is Nick Thorpe. I'm the Network Director of the Global Green and Healthy Hospitals program at Healthcare Without Harm. Today we have attendees joining us from around the world. So good morning, good afternoon, and good evening to all of you. We really appreciate you taking the time to join us today for what is an event that we've been looking forward to for many months now, which is the launch of Race to Zero for the healthcare sector. Race to Zero is a global campaign organized by the United Nations high-level champions on climate change to rally leadership and support from businesses, cities, regions, and investors for a healthy, resilient, zero carbon recovery. It's a fantastic campaign and one that Healthcare Without Harm, my organization, was really honored to become an official partner of at the end of 2020. Through our work as a partner, we are engaging and mobilizing the healthcare sector around the world to set really ambitious targets to achieve net zero emissions. This is really important work for healthcare to step up as a leader and to show that they are part of the solution and are also part of the movement to encourage others to do the same. So today we have an excellent event where we're looking forward to unveiling who these initial founding members are that we've been able to work with and recruit and engage that have made commitments to target net zero emissions and really set a new trajectory for what sustainable climate smart healthcare can and should be. This event is especially important for us at Healthcare Without Harm as we're celebrating our 25th anniversary as an organization working on sustainable and climate smart healthcare. So for us, this event, seeing healthcare setting this trajectory for net zero emissions is a fantastic addition to our year celebration. I'll provide a little bit of a background on the event and how it will flow for us today. The first half, we have a group of fantastic speakers that have taken time out of their day to join us, coming from the United Nations high-level climate champions, the World Health Organization, and also Healthcare Without Harm. They'll be providing a bit of a background on Race to Zero, why this work is so important at the global level, and some of the work that's happening to support hospitals in making this a reality. In the second half of the event, we'll transition and showcase the voices of the hospitals and health systems and healthcare facilities from around the world who have made this commitment to net zero emissions. And they'll be discussing with us why this is so important for their organization, why it's so important for healthcare in general, and why they see it as an integral part of what sustainable healthcare can be going forward. So I do want to say that we are doing simultaneous Spanish translation during this event. So if you are a Spanish speaker and you would like to hear the event in Spanish, please follow these instructions on the screen here. I will also note that due to the translation, there will be a bit of a lag in speakers as we cycle through the translations. So you may hear a 15 or 20-second pause just to let the interpretation catch up. And so with that, I'd like to kick off our event here and introduce our first speaker, who is Gonzalo Munoz. He's the UN high-level climate champion from Chile for COP25. He's one of the organizers and creators of Race to Zero. And Gonzalo is going to share with us some information on Race to Zero, why it's such an important initiative, what they're hoping it will be, what the inspiration is behind it. And Gonzalo will also be unveiling our initial founding members that are coming in from the healthcare sector. So with that, Gonzalo.
Thanks so much, Nick. What a real honor to be here and join you today. Thanks a lot for having me. First, an explanation for those that not necessarily understand the role or where it comes from. I have the privilege of being one of the two high-level climate action champions. I was appointed by the Chilean government as the country that hosts the COP25. and I work closely and in partnership with my dear friend Nigel Topping, the UK high-level climate action champion for COP26. That's how the role is being designed for both champions to collaborate and to work together in order to ensure the continuity. Our role is quite literally to champion the ambition and actions taken by non-state actors in addressing climate change in order to fulfill the Paris Agreement and support the nations so they can increase their climate ambition. This means that Nigel and I work with partners across the world around cities, states, regions, businesses, investors, and civil society groups to raise the awareness, increase the ambition, and the levels of climate action being taken to address climate change. To fulfill our mandate, we launched back in June last year the Race to Zero campaign that Nick mentioned, the UN-backed global campaign rallying non-state actors from across the global economy to take rigorous and immediate action to halve global emissions by 2030 and deliver a healthier, fairer, zero carbon world in time. That means 2050 at the very, very latest. All members are committed to the same overarching goal, reducing emissions across all scopes swiftly and fairly so that we can deliver on the promise of Paris. In the first year of the campaign, so as I told, it was launched back in June 5th last year. Now we brought together throughout our partners close to 4,000 members alone, making up over 15 of the global economy. So we went from 0 to 15 of the global economy, then joining the commitment from the nations, from the parties. We now have over 80% of the global GDP already committed to the same goal. This is a massive change, and overall, despite COVID, the campaign has grown by 20% in the last month alone. So we're gradually seeing more and more actors from across society come together to raise ambition and start taking action. Seeing this radical collaboration in action is critical because COVID has reminded us how fragile and interconnected we are as a society, and has re-emphasized how global health lies at the heart of everything we do. How we tackle climate change will possibly impact our human health and our resilience as a global society. Together, it is imperative that we build back better and create a fairer, more equitable society. So for more than a year, the world's doctors, nurses, hospitals, and health system have been on the front lines in the battle against COVID-19. Many have served heroically as first responders, caregivers, truth tellers, and anchors of resilience in communities that have been hardly hit by the pandemic. A growing number of these leaders are now recognizing and speaking out about another major health crisis that is looming. The growing climate emergency threatens to make the COVID-19 pandemic pale by comparison, impacting the health and well-being of nearly everyone all across the globe for generations to come. This is something that is growing as a learning from COVID-19, and hopefully we can use it as an element that will then leverage all of our action around climate. Ironically, healthcare, whose mission is to heal, contributes to more than 4.4% of the net global greenhouse gas emissions, making the sector, if it were a country, the fifth largest climate polluter on the planet. Healthcare is one of the largest and fastest growing segments of the world economy, and under a business as usual scenario, absolute sectoral global emissions would more than triple by 2050. So hospitals and health systems from all over the world are increasingly recognizing that healthcare must step up and act now, again, mostly if we take the learnings from COVID. On behalf of the Race to Zero campaign, myself and Nigel are absolutely thrilled to welcome the first cohort of healthcare institutions joining Race to Zero through our partner initiative, Healthcare Without Harm, representing over 3,000 hospitals and health centers in 18 countries. These institutions are as diverse as they are numerous. truly representing the global nature of Race to Zero. And that's something that we want to highlight because it resonates so much with the values that we need to carry with the campaign. From individual hospitals to large-scale health systems to provincial health departments, these new healthcare members are stepping up to achieve net zero emissions for the health of their patients, communities, and the planet. They have the capacity on bringing also the message and the culture that is around the campaign to so many citizens around the world. With this commitment, they are asserting themselves as global leaders and redefining what truly sustainable climate smart healthcare should be. Our aim by the Glasgow Climate Conference is to have a leading cohort of health ministries committed to healthcare climate action together with a growing movement of hospitals and health systems doing the same via Race to Zero. That's what the role of the climate champion is about. Do the bridge between the non-state actors and the nation so we can all work together toward increasing the ambition. To work together, all of them, they can begin to put the healthcare sector on the trajectory to align with the ambition of the Paris Agreement of keeping global temperature increase at or below 1.5 degrees. So we deeply and truly welcome all of the new members to our global group of Race to Zero members from around the world and are honored to work with them as part of this collective. We will only win this race if we win it together. So I hope this wonderful event inspires not only other healthcare institutions to join healthcare without harm, but also other industries to take on the challenge and the opportunity of racing towards a better future for all of us. Thank you very much. Back to you, Nick.
Thank you so much, Gonzalo. It's really an honor to be working with you, and we look forward to the collaboration going forward with Race to Zero. And we are as excited as you to welcome these nearly 40 healthcare institutions from around the world to the initiative, and we look forward to growing this as we go forward in the lead up to COP26 and well into the future. So thanks so much again, Gonzalo. For our next speaker, we're going to introduce Diarmuid Campbell-Landrum, who is joining us from the World Health Organization. Diarmuid is the head of the climate change unit at the World Health Organization. And Diarmuid's going to share a bit of impressions and thoughts on why this level of commitment and ambition from the healthcare sector is so important at this time. Why net zero emissions and setting that as a trajectory and a goal is integral to the future, to protect people on the planet, and also a bit about how the World Health Organization is supporting this work in their own right. So Diarmuid, I'll pass it to you.
Thanks very much, Nick, and thanks for the opportunity to speak at this really, really important event. So the virtual backdrop behind me is the World Health Organization headquarters building. At the moment, we have our World Health Assembly going on, so we have connections from heads of government and ministries of health from around the world. And as you can imagine, their main attention is fixated on COVID. But at the same time, we also have at least one eye on the climate crisis. As our Director General has said, we now have a vaccine for COVID. There is no vaccine for the climate crisis. And so even in the early stages of COVID in May last year, we published a manifesto for a healthy and green recovery from the COVID crisis, which laid out 6 prescriptions, and a couple of those are absolutely central to what we're talking about here today. We talked about providing essential services within the health sector, energy, water and sanitation and so on, making sure they're resilient, but also getting behind the energy transition, because that is what is going to safeguard the planet, combat the climate crisis, but also bring huge health benefits. So it's climate change is now absolutely front and center in what WHO does. And the reasons for that are very clear. Climate change is an existential crisis for the planet, for the people of the planet, and first in line for vulnerable populations in low-lying areas. Over a decade ago now, our Director General referred to climate change as the 5th horseman of the apocalypse. After war, famine, pestilence, and death comes climate change, making all of those problems more severe. So we all have to play our part in driving down carbon emissions, because we know that if we don't, We will continue to see more extreme, more frequent extreme weather events. We will have conditions which make it easier to transmit vector-borne disease, waterborne disease, and so on. We will continue to put pressure on agricultural food systems, driving up the risk of malnutrition, food insecurity. And we will also continue to suffer the burdens that we already get from the drivers of climate change. So you will probably be aware that air pollution, and about two-thirds of outdoor air pollution is caused by fossil fuel combustion. Air pollution around the world kills about 7 million people every year. It's as big as any health risk factor that we have. So we have a whole range of reasons why we have to get behind the drive to driving down carbon emissions and driving down pollution. And as you've already heard from Gonzalo, there is a responsibility on the healthcare sector now, unfortunately. We can make the argument that the healthcare sector should have a right to pollute. It should be the sector that gets a pass on this, because it is saving lives. But it is now the case that healthcare around the world, you'll hear this figure many times, contributes between 4 and 5% of global carbon emissions, and in the richer parts of the world, that's up to about 10%. So we do have to play our part in driving down carbon emissions. And so what are the headlines of what we need to do? Well, the first is to level off and drive down emissions in the highest income countries. And we also start to see the signs of really big changes in being able to do this. So you'll hear of lots of really good examples of those early movers on driving down carbon emissions from around the world. The one that we like to quote, because it is the biggest, is the National Health Service in England, the biggest single health service in the world, which has already reduced its carbon emissions and has made a commitment to go net zero by its centenary in the 2040s. And they're now investing heavily in this area, and all of their future plans basically build in that commitment to net zero. So that's the first thing we have to do. We have to drive down emissions where they're high. We also have to ensure that developing economies are on a path that also avoids them taking that high emissions trajectory. Now, in the developing economies, particularly in the poorest parts of the world, they need to use more energy. They will have to some extent, emit more, or at least have access to more energy. In the poorest parts of the world, about half of healthcare facilities have no access either to energy or reliable energy, so their consumption has to increase. But there is no reason now why that has to be polluting energy. The costs of renewable energy, clean energy sources have been dropping so fast that in most parts of the world, that is now the cheapest form of energy. It's not always the most profitable form of energy. It's easier to still, unfortunately, to extract profits from fossil fuels. But that's why society has to step up and to make sure that we're choosing the energy choices, the consumption choices, which are good for society as a whole, not just for the extraction of profit. And in many cases, even in the poorest parts of the world, that is now renewable energy rather than fossil fuels. The next thing we have to do is to put health at the center of climate discussions. If you ask people in the street what they're concerned about in relation to climate change, and if health is on their list of options, health will tend to come out top. And it's also the framing of the climate issue which is most politically unifying. So if you present a picture of why we need to act on climate change and reduce carbon emissions as a positive one, which brings better and healthier lives for people, that tends to unite people across the political spectrum. And as Gonzalo has just underlined, the COVID crisis has underlined just how important people and governments consider health to be. They're prepared to effectively stop economies for a substantial period of time in order to safeguard health from COVID. So it's really important that we put health front and center in the climate discussions. And here I think we have very good news. The UK presidency of COP26 has done that, and partly I think over voices like those represented on this call, speaking up over many years, but also driven by the COVID crisis. And they are now showing how a positive health framing can contribute to the discussions they're having on transport or on energy or on adaptation and finance and so on. And they've also launched a whole series of new initiatives, so including supporting this one critically, but they're also encouraging initiatives on one that we're heavily involved with, on building climate resilient health systems. And those two interface very well. Often the things we need to do to make health systems resilient can also drive down their emissions, but they're also encouraging initiatives or supporting initiatives on ensuring that the nationally determined contributions, the commitments that countries are making to the renewal of the Paris Agreement also include health, encouraging research on health adaptation to climate change, and opening the door to the mobilization of health professionals to speak up on climate change. So this initiative is really important on reducing emissions within the healthcare sector. And it also connects to a whole series of health arguments that we can take forward. But part of the reason that this one is so important, it is the health sector leading by example. It's difficult for us within the health sector to tell others to reduce their emissions if we're not reducing our own. So it also plays into that larger role of the health sector. And so what are the resources that we have on our side? What are the strengths that we have on our side as the health sector? As Gonzalo has already said, healthcare is a big industry. It's not only a big emitter or a significant emitter, it's now 10% of the global economy and rising. So it's also a big customer and it buys in bulk. So it is big enough to shape markets. So it matters if the government of the UK decides that the health sector will buy green. It matters for big private health sector providers if they're going to raise their environmental standards. So it's so big that it has that opportunity to have an impact on industry as a whole. There's also a lot of public support. Health is an indispensable service, and studies have shown that the public tends to support the health sector becoming greener as long as they're able to continue to provide that essential public health service. And that's what we're now able to do. I think we've got enough good examples of where we're able to continue to provide excellent healthcare, which is also greener. But the single biggest strength that we have on our side is the people. Health workers, they're numerous, they're connected in every society, and they're highly trusted. The second most trusted profession in the world is doctors. The most trusted profession in the world is nurses. It really matters what health professionals say, because they have that leadership role in society. So just a couple of comments on what I think that means for health professionals, for our engagement. So WHO has designated 2021 as the year of the healthcare worker and care worker, particularly in gratitude for what they've risked, what they've sacrificed, and also what they've achieved, what they've delivered in protecting people's health from COVID. So we're hesitant to ask people to do more. And yet at the same time, we see health professionals actually stepping up and engaging and saying, we want to act on climate. We see this as the next, well, it's the big current and future challenge. So there's a great deal that can be done individually within individual healthcare facilities. And you'll hear, I think, stories of that today. And that is really important, because that sends a signal that we are taking care of our own business. We are leading by example. But the final thing I wanted to say to health professionals is it's also critically important for you to make your voice heard outside of the hospital. We know that even the emissions from the healthcare sector are driven more by where the healthcare sector gets its energy from, or the supply chains. And we also know, because of that trusted role of health professionals, because it matters so much what health professionals say, that what you can say in terms of making the argument for climate action will be at least as important as what you can achieve within your own practices. So individual change is really important, but we also need system change. So in order to achieve that, well, we need a goal. Net zero is the goal. We also need a map to get there. So I think this is the point at which I hand over to Sonia to introduce that goal on that map. Thanks very much, and back to you.
Thanks so much, Dermot. We really appreciate you taking the time to join us today, and I couldn't agree more that voice is so powerful, and strengthening that voice and size with Race to Zero or with other initiatives similar to that to speak as a collective can make that even more impactful. So next, we'd like to go to Sonia Roshnik, my colleague here at Healthcare Without Harm, who is the International Climate Policy Director. And Sonia is going to share some words about the work that Healthcare Without Harm is doing to support this goal of net zero and becoming a reality, how we're supporting this happening at international and national levels, but also how we're supporting this work happening and becoming a reality at hospitals on the ground around the world. So Sonia, I'll pass it to you.
Thank you very much. Thank you, Nick, Gonzalo and Dermot for setting the tone for this event. We really appreciate the partnership. And indeed, like everybody said, this is a key moment, not just because the climate crisis is finally recognized as a health crisis, but also because it's an area of special interest for COP26 in Glasgow. And like Dermot said, there is an initiative afoot in partnership with the COP presidency, Race to Zero, the World Health Organization, the Greener NHS, to encourage countries to declare their ambition for resilience and low carbon healthcare. So, and Dermot mentioned the ones that relate to resilience. There's also the ones that relate to decarbonisation, and clearly these are all very intertwined, as highlighted. Luckily, with Healthcare Without Harm, we published a roadmap to help countries develop their ambition and start implementation. It really highlights the road to zero, so the race can be easier, we hope. And it really demonstrates that it's crucial to act, because like Gonzalo mentioned, emissions will grow across healthcare if we don't take specific action within the health sector. It will grow by 3 times the amount if we don't take things into consideration. That is why Race to Zero is so key. So the roadmap indicates 3 areas of intervention and 7 high impact actions. And we need to operate across all of them to chart a course to zero. So I'll briefly summarize them. The first really is making sure that we do everything we can within healthcare operations, be that the way we prescribe drugs, be it the energy that's used in facilities, be that how we manage waste, and how we manage our clinical interventions so that they are low carbon. The next one really relates to the supply chain and how they are made and how we dispose of them throughout their life cycle. And that is absolutely critical, and particularly when you recognize how much contributes to the overall footprint of healthcare. And the third really is what we can influence through wider society. Just like Dermot said, we have a role to make sure that all the structures that support the health systems, be they energy, be they transport, be it around food and agriculture, are all key to help get us to zero. And so the roadmap also highlights 7 key interventions. And I'm going to try and go through them, not in any great detail, but there is one which has been mentioned already, which is transitioning to 100% renewable energy, making sure that buildings are absolutely low carbon because we're reusing building materials or we're positioning them in the right place and we're making good use of buildings. Obviously, electrification, active travel is important. Food has already been mentioned, is key and obviously a fundamental to health. And we've mentioned pharmaceuticals, making sure that we choose the right kind of inhalers or anesthetic gases because they contribute to greenhouse gas emissions more than any other aspect. And also how we prescribe other medicines is part of that. Making sure that we contribute to a circular economy, and the health sector has got a real role to play in contributing to a circular economy. It's how we use products and how we dispose of them and how we order them, how we stock them, all of those elements. And then there's something about effectiveness in our models of care, making sure that we're truly orientated towards delivering health rather than just trying to save from sickness. It's a real public health agenda that we need to get right. And even through those impacts, those key actions, we'll still have to do more in order to track to zero emissions. So one of the great things about this roadmap is that we now can work with countries to support them to detail what that might look like at country level. And we'll be working with 5 to 6 countries more specifically to translate that at country level, including the Netherlands and Portugal and some others. So the organizations that have joined Race to Zero, they're all pioneers in this space. And I thank them for joining and for being here today to represent the work that's being done. And they can really support governments to show them the way, to give them confidence that they can raise their ambition. So I'm really hoping that that will be one of the roles, as well as raising the ambition amongst other health sector organizations who can be taking a course to zero. So we hope that this bottom-up and top-down approach will really help accelerate the transformation required, the transformation that David so explicitly described. So we've set up a global tool to support organizations to measure and track their reductions and benchmark progress with each other, as you would do in a race. This will help us know whether we're meeting our requirements, and we hope you'll all join us in that race. We're super proud today to announce all the organizations that are part of this work, and we will support any organization that wants to join the race to keep building momentum and accelerate action to reduce emissions. So before we hear from some of these leading lights around the world, we'd like to share a video with you, which sort of acts as a reminder of why this is so key to health professionals. We've heard it already, but this will just reinforce that. Healthcare Without Harm partnered with the Skoll Foundation and Freethink to produce a video, which features experts from around the world discussing the health impacts of climate change. And it's probably a useful moment to just remind you that 84% of the carbon footprint of the health sector globally relates in some form to fossil fuel combustion, be that through the energy or plastics or other items that are generated from fossil fuels. So it's quite key. So health professionals are on the front lines of healthcare delivery and working with communities to raise awareness of the health impacts of air pollution and the climate crisis. They're all, and as a health professional, we are all, and you are all, and thank you for being with us, committed to creating a more sustainable and resilient healthcare sector and a healthier future for all. So we'll watch the video now and then go on to our pioneering organizations. Thank you.
I used to see black spots on the lungs, mostly smokers. Over the last decade or so, I saw teenagers with black spots on the lung. And I thought to myself, oh my God, what's happening?
The answer, it turned out, was in the air.
The interplay between climate change and health is a really important one. The bushfire experience across Australia was an extraordinary experience. Some thousands of people were in hospital. They had heart attacks and strokes, all sorts of different things.
Unfortunately, the healthcare sector around the world is a huge contributor to global greenhouse gas emissions and climate change.
If healthcare was a country, it would be the 5th largest climate polluter on the planet. Two of the greatest health threats of the 21st century are climate change and a global pandemic. And we've got one on top of the other. If you want to have healthy people, you need to have a healthy planet.
Indeed. And right now we'd like to transition to hear some of these voices, hear some of these leaders, hear from people on the front lines working at healthcare who are making this commitment to net zero and setting this really ambitious target. We're going to do a bit of a net zero round the world tour here. No emissions for this flight will come from our journey here. But we're really happy to have several of representatives from organizations who have joined Race to Zero and made this commitment join us today to share their words and thoughts on why this initiative is so important and why decarbonizing the health sector is essential for the work. It's going to be a mixture of videos and live presentations that we have, and we're going to start in Latin America, where we had several organizations join Race to Zero as part of this founding group. We're going to see 2 videos here back to back to each other. The first being from the Hospital Universitario Austral in Argentina, where Veronica Torres Serino, who's the head of the toxicology and environmental unit, will share some words regarding her organization. And following that will be Andres Alvarado Calvo, who is the quality and environment manager at Hospital Clínica Bíblica in Costa Rica. So we can play those videos now.
El Hospital Universitario Austral se comprometió a 0 emisiones para el año 2050. Desde hace más de 12 años venimos trabajando en el cuidado de pacientes sin descuidar el ambiente que nos rodea. Porque creemos que no es posible tener humanos saludables sin un entorno saludable. Es por esto que trabajar en el cuidado del ambiente es generar personas sanas. Con la eliminación del mercurio en el año 2008, fuimos trazando distintas acciones en sustitución de químicos, manejo eficiente de agua, energía, productos farmacéuticos, y esto tratamos de llevarlo con acciones hacia la comunidad a través de campañas educativas. Además, fuimos trazando y delineando un programa de compras que tuviera en cuenta en todas las adquisiciones el cuidado del planeta, desde la compra hasta la disposición final. La verdad que hicimos muchas cosas, pero sabemos que falta mucho para que la salud sea verdaderamente sustentable y resiliente. Comprometernos con Carrera al Cero es plasmar un plan concreto que nos permita llevar al cuidado del planeta acciones claras en todo nuestro trabajo cotidiano. La meta, cuidar la vida, hacer medicina de calidad y cuidar nuestro planeta, que es nuestra casa común.
Mi nombre es Andrés Alvarado y represento al Hospital Clínica Bíblica en San José de Costa Rica. Nos sentimos muy complacidos por la invitación que nos ha realizado la Red Global de Hospitales Verdes y Saludables para participar en la campaña Race to Zero de Naciones Unidas, que busca la mitigación de emisiones a cero de CO2 equivalente para el año 2050. Lo anterior se complementa de manera muy importante con nuestro programa de carbono neutralidad, el cual durante los últimos 8 años y a través de procesos de auditoría externa nos ha permitido demostrar nuestro inventario de emisiones, reducciones y compensaciones de CO2 equivalente en nuestras instalaciones. Tal y como lo define la normativa vigente, nosotros hemos implementado una serie de acciones dirigidas para la reducción de energía y de emisiones. Por ejemplo, contamos con 228 paneles fotovoltaicos para generar electricidad por medio de luz solar. Además, contamos con 24 paneles solares para calentar agua. Y de igual forma, tenemos luminarias LED en todas nuestras instalaciones, tanto en sede central como en nuestra sucursal de Santa Ana. Agradecemos nuevamente la invitación realizada por la Red Global de Hospitales Verdes y Saludables y por Naciones Unidas y nos comprometemos a realizar estos esfuerzos en pro de nuestra salud ambiental y la de nuestra comunidad.
So thank you to Veronica and Andres who may be here as attendees today. We really appreciate you sharing your words and thoughts on this. And I think Veronica really hit it well, saying, you know, caring for people, providing quality care, and caring for the planet can all go hand in hand. So next we'll fly up to the United States and to the state of California, where I'd like to introduce Colleen McCormick, who is the Sustainability Director for the University of California, Davis. Colleen?
Nick, it's a privilege and an honor to be here with everyone today. Signing on to Race to Zero confirms the commitment of UC Davis Health to achieve carbon neutrality in scopes 1 and 2 by 2025, which is a system-wide University of California initiative. UC Davis Health strives to be a leader in demonstrating tangible ways for healthcare to address climate change while improving health outcomes and reducing costs. As identified by the World Health Organization, climate change is the greatest threat to global health in the 21st century. Climate change truly is a public health crisis. Given that healthcare contributes 10% of US greenhouse gas emissions and nearly 5% of global emissions, it is imperative for healthcare to actively work towards decarbonizing its operations. UC Davis Health is dedicated to improving the health of our patients. Decarbonizing is essential for the current and future health of all patients. We also aspire to be an example that other health systems can emulate. Thank you.
Thank you so much, Colleen. We agree that we love to showcase you as an example and all the leaders who have joined Race to Zero here to inspire other hospitals, healthcare facilities, and systems to do the same. So thanks so much, Colleen. We will fasten our seatbelts and hop back on the plane and fly over the Atlantic Ocean to Europe, where I'm pleased to introduce Christian Gra, who is the head of respiratory medicine and the lung care center at Hospital Havahoa, which is a new member to our network who joined Race to Zero just recently. Christian?
Yes, hello all over the world. We are a hospital in Germany, in Berlin, with 900 employees in the public health system of Germany, with 400 beds and 40,000 patients annually. We were the first hospital in Germany to publicly declare that we will be completely climate neutral by 2030 in Germany. We believe that hospitals and healthcare institutions can be important change agents to make society think differently. It is important for our organization to join the Race to Zero because the participation in Race to Zero supports our work and help us to bring our hospitals along on the path to climate-friendly healthcare organizations. In the last 20 years, we have achieved a decarbonization of 70% in relation of 1990. In the next 5 years, we want to reduce the carbon dioxide emission to zero. But we want to go further. In addition, we will involve all partners and supply chain in our zero emission project. We all know the climate crisis, the greatest health crisis facing humanity and our planet. Our project in Berlin, in Germany, started from a special point. The overcome of crisis, we see that in the world, human health and care for the earth must go together in you. That is why we have built a hospital with integrative medicine and are now fighting for a planetary concept of health. The culture of medicine, our opinion is, has to get a new and modern holism. Then we don't destroy the world and can still use modern techniques. Why is it important for the healthcare sector to decarbonize? That we find a large group of hospitals that also pronounce the goal zero emission hospitals. As an alliance of zero emission, we would have an enormous force in the healthcare system to become a change agent in the society at whole. And we think this message will be understood in the world. And without the health of the earth, there is no health for the people. Thank you for you co-working and all of your energy as change agents around the world. Thank you very much.
Thank you very much, Christian, and congratulations on all your progress to date. We look forward to working with you to achieve the net zero goal and achieve spreading the message of planetary health in Germany and around the world. So from Germany, we will take a quick jump to the UK, where it's my pleasure to introduce Susie Vernon, who is the Associate Director of Sustainability at Sussex Community NHS Foundation Trust. Susie?
Hiya, Nick. Thanks for that. We've been working on sustainability for a while here at Sussex Community. And in fact, our journey started back in 2010 with our then sustainability lead, Will Clark, who some of you will know from the Healthcare Without Harm team here in Europe. The Trust has always been ambitious in the area, and in fact it was back in 2014 that we first committed to becoming net zero through our sustainable health programme Care Without Carbon. And 10 years on, we've made real progress and across a whole range of areas, from travel and energy efficiency to circular economy and staff engagement. We've cut our carbon by over 4,000 tonnes, saved over £10 million and made some measurable improvements in staff wellbeing. And on top of this, we've tried to really increase our impact by supporting other trusts both locally and further afield. So some really good progress, and we're proud of that. But of course, the question is always, what's next? Clearly, some deep climate challenges, but such significant opportunity for health benefits too. And we've heard a lot about that from Dermot today. So in a way, it's quite an exciting moment actually, and really potentially a turning point. We can only hope. We were asked to talk about the greatest benefits to decarbonising our organisation today. And I think for us, it's actually been these health opportunities that come through the carbon reduction work, the co-benefits on health. It's these co-benefits that have actually really helped the Care Without Carbon programme make sense to our staff and of course to our patients, and got people interested in getting involved, which is critical to any carbon reduction programme. As a sector, we're in a great place to influence our communities and our patients. And in a way, it's for this reason I think decarbonisation of the healthcare sector is vital, not only because of the direct environmental impact of the sector itself, which we know is massive, but because of the potential to influence change elsewhere. And actually, for us, that's also why being part of Race to Zero felt like such a positive thing to do. It will really help to maximise the impact of our work, which is what we're all about. By learning from others and sharing our learning, by showing that change is not only possible but also a health opportunity, and by inspiring others to take action on climate change, the action that's really so dearly needed across the globe. So a big thank you to you and CCC and Healthcare Without Harm for this opportunity, and we look forward to working with you guys in the months and years to come.
Thanks so much, Susie. We really appreciate you joining us, and looking forward to showcasing all the success that you've had there and inspiring others to do the same. So we will take another longer journey here and head back to the Southern Hemisphere to South Africa, where I'm really pleased to introduce Chris Maud, who is the Chief Electrical Engineer at the Western Cape Department of Health. Chris?
Apologies there, I just had to unmute myself. Good day, everyone. Yes, the Western Cape Government Department of Health is joining the Race to Zero 2050 as we're public leaders in community healthcare in the Western Cape in South Africa. We just wish to demonstrate that we care about sustainable healthcare in relation to the environment, which supports the community actually depending on it. One of our 5L agenda in our strategic documents is low impact. This is reduction of the carbon footprint by introducing green building principles, particularly in terms of energy and water, materials, land use and ecology, indoor environmental quality, transport and emissions. In delivering public healthcare to citizens of our country, quality service delivery requires innovative technology to keep with the times, which in turn requires power and energy to support these innovative technologies. This then relies on primary energy sources like power stations, which still rely heavily on fossil fuels in our country. And unfortunately, I have to say, we are actually in a few hours of load shedding right at this minute. So it's one of those realities of the current state of affairs. And decarbonizing the health sector by employing efficient technologies and even energy sources on site as an alternative to fossil fuels will reduce the reliance on these fuels and contribute to a healthier and more sustainable environment. Against this, it's important to note that the Western Cape is experiencing a demographically increasing population, and this places pressure on carbon emissions to support the population. Through efficient, effective and innovative healthcare at our facilities, we can possibly mitigate this impact. Primarily, we aim to substantially reduce utility operating costs by firstly becoming highly energy efficient, then introducing alternative means of local on-site energy generation to supplement the authority power supply. We are currently engaged in various energy efficiency programs, as well as decarbonizing activities, such as the reduction of healthcare risk waste through the Green Disposal Project. Decarbonizing will also ensure the long-term sustainability of quality healthcare services to the public and especially the poor. By focusing on the fundamentals, the benefits of decarbonizing will have far-reaching effects on the sustainability of the environment and the general population and impact positively in no order of priority on life expectancy, poverty, health, disease, hunger, and sustainable cities and communities. These are the great benefits we see from this effort as an organization. And these goals are enshrined in our strategic plans as Sustainable Development Goals, or SDPs, in support of the 2030 Agenda for Sustainable Development adopted by world leaders at the United Nations in 2015. World leaders at the September 2019 SGD Summit have called for a decade of action, and Western Cape Government Department of Health has joined this global effort, and we're quite proud to do so. Thank you for the opportunity and best wishes to everyone in all your efforts. 2050, here we come. Thank you.
Thank you, Chris. It's fantastic to have this commitment from a provincial health department in the Western Cape Department of Health to be a part of Race to Zero and your long commitment to sustainable healthcare and our partnership with Healthcare Without Harm. Our next two speakers will actually also be video submissions due to time zones. We're heading to Asia, where it's quite late. And our first video here is going to be from India and the Aravind Eye Care System. Before I introduce the video, we do want to express our condolences to the Aravind Eye Care System and the friends and family of Thiru Srinivasan, who we found out just passed a few days ago. He was their director of finance and a leading force behind the organization and all their facilities for the last 45 years. So we send our condolences to the system and then the family of him. Dr. Ravindran, who is the chairman of Aravind Eye Care System, presented some words that we'd like to show you. And also I'd like to say that Aravind Eye Care System is one of 4 healthcare institutions in India who joined over the past few weeks, where I think we all know they're suffering from a terrible bout with the pandemic and COVID. And so for them to join at this time, I think speaks volumes to how important this work is, both for them and the world. So let's play that video.
Evening. Aravind Hospital is keen to join this global initiative, Race to Zero, as it aligns with one of our founding principles, which is frugality. At the core of this principle is not being wasteful of any resource, either of the hospital or of the patient. This directly relates to the carbon footprint and environmental sustainability. Healthcare organizations are energy intensive and also people intensive, including multiple visits by the patients and their family members. So it is important to be mindful of this, and we have been addressing this on 2 fronts in Aravind. At the design level, we have focused on simple building designs that helps in natural ventilation and light to the maximum. Over a period of time, we have switched over to using energy efficient fixtures, equipments, and also moved towards using green energy either through generating on our own or purchasing either solar or wind power. We have also adopted sustainable wastewater recycling system for the past 20 years. These continue to yield environmental benefits day after day and also have minimized our operational cost. Where we have reaped the maximum impact is in the design of our day-to-day patient care activities. We discovered that greater patient centricity proportionately lowers the carbon footprint. For instance, minimizing the number of visits to resolve a condition is very patient-friendly. A patient with cataract can complete all investigations and can get operated on the following day. All of this essentially in a single visit. This approach reduces their cost, transportation need, at the same time reduces the travel-related carbon footprint. This strong synergy between patient centricity and carbon footprint has been a triple win for us. Happy patients, growing patient volume, and reducing carbon footprint. So we are sure we will learn more through this collaborative effort to further reduce the carbon footprint arising out of our services towards eliminating needless blindness. Thank you.
Thank you to Dr. Ravindran and his submission. And I think the happy people and the lower carbon footprint is just what we need. It's a great tagline. So for our last part of this journey around the world, we will head to Australia, which is another video submission. It's quite late there at night, but we're really pleased to have Ambulance Victoria join Race to Zero. They were one of the first members in this outreach. And our video today is with Sally Mangan, who is the Director of Sustainability there.
At Ambulance Victoria, as a health service, we believe it's our responsibility as part of our social and environmental responsibility strategy to act on climate change. It's our social license to operate to do that. And the final benefit is the most important of all, that it's the health outcomes. To better the health outcomes by acting on climate will benefit the entire community. So some examples of what we're doing here at Ambulance Victoria to act on climate change include setting some fairly ambitious emissions reduction targets. We have set a goal to be net zero by 2045, 5 years earlier than originally expected, and some targets for the next 5 and 10 years. So we hope to reduce our emissions by 39% by 2025 and 60% by 2030. We believe in acting on this. We're showing our responsibility to acting on climate, but also reducing the impact to the Victorian community that we serve. So those science-based targets are great, but we're actually taking tangible action at the moment to reduce our emissions. Last year in 2020, we signed on to a renewable power purchase agreement for a lot of our larger sites that immediately reduced our emissions by 7%. We're also working with our fleet team to start transitioning to hybrid vehicles and then plan for a zero emissions ambulance vehicles into the future.
Thank you very much to all of those. That's a whistle-stop tour we've just done around the world, highlighting some fantastic examples. But of course, we've got some slides to highlight that we've got with this first cohort quite a number of people from around the world. So we've got a number of people from organizations that have joined from Brazil, that have joined from Argentina and Chile, and the US and Mexico. So I'm delighted about, I'm not going to list them all out because it would take too long and we'll be tight for time, but I'd just like to recognize how wonderful it is to have such a big cohort across the Americas. And thank you to all of those of you that have been following the Spanish translations on this call. If we move over to the next slide, please. We obviously have some examples from South Africa and across Europe, and we hope we can grow those as well. A lot of there's 4 across the UK. We've got 1 in France, the Hôpital de Niort. I think Bernard is listening, maybe on the call as well. We've got 4 in Germany. So I'd like to congratulate all of you for being part of that first cohort. And the last slide highlights some of the organizations again. In India, where we've got a number that have been starting to join, and in Australia as well. And we hope that those numbers will be growing. This is very much our first sort of cohort. They're the pioneering lights. We hope that this will inspire many other organizations to join Race to Zero, and also that you will all join us in putting a bit of pressure on governments to up the ante on their ambition to race to zero and develop resilience across their sector, because that is so important. So I'd like to take the opportunity to thank Gonzalo and Dermot and Nick and the whole of the Race to Zero team for supporting us on this. I'd like to thank all the organizations that we've listed here, 39 of them that have joined Race to Zero, from all those different countries and representing over 3,000 different organizations, for taking a lead and for speaking out today. I'd like to thank all of you who've made the launch possible, and the 250 of you from around the world that have joined us today. I hope that you will join us on this Race to Zero. It's such an important role for the health sector to play, to demonstrate that we can do this despite the pandemic, and that this is really ultimately an important health issue. And I'd like to thank mostly all of you out there who are working in this space and have been working in this space for a long time to help raise this ambition and accelerate action for a healthier planet and future for all. That is what we're all here to do. And it really feels that this is a key moment for us to drive that acceleration and to join the race. So please join us at Race to Zero. The race is on. Thank you very much.